Picture this. You're lying in bed. It's 2 a.m., and the house is perfectly pin-drop quiet. Everyone else is fast asleep. And then it starts. A strange, heavy pressure right in the center of your chest. It's not sharp. It's not stabbing. It just feels heavy. Almost like someone placed a brick right on your sternum and is slowly, deliberately pressing down. You try to shift your position. You take a few slow breaths, and well, maybe it eases just a little bit. You close your eyes, trying to drift back off. But then you wake up again. This time, your left arm feels oddly numb. There's a faint, kind of unexplainable tightness in your jaw, and a cold sweat is forming on your forehead, even though the room is perfectly cool. And then you tell yourself, I'm probably just stressed. I'll feel better in the morning. You try to just sleep it off. You know, this exact rationalization happens every single night, all across the world. Older adults feel these ambiguous symptoms and just dismiss them. But the information we're looking at today, it could literally be the difference between waking up tomorrow morning or not waking up at all. Welcome to The Explainer. Today, we are decoding the hidden warnings your heart might be trying to send you. Every single year, hundreds of thousands of people experience a heart attack and don't get help in time. And it's not because they felt nothing. It's because what they felt simply didn't match what they expected. So let's translate those whispers. We've got a really clear roadmap for today. We'll start with the anatomy of a heart attack, then look at 4 misleading warning signs. After that, we'll cover the immediate action plan, and finally, long-term heart protection, so you'll know exactly what life-saving steps to take by the end of our time together. Okay, Section 1, Anatomy of a Heart Attack, the silent buildup. Before we get into the symptoms, we've got to examine the underlying biology of your heart. It's a tireless, fist-sized muscle that's been beating every single second since before you were born. And just like any other muscle, it relies entirely on a constant supply of oxygen-rich blood. This is delivered through a network called the coronary arteries, which wrap around the heart like a crown. Keeping the heart fed, that is their absolute non-negotiable job. Now, it's actually fascinating how the data completely shatters a massive, dangerous myth. I mean, we're all kind of waiting for the dramatic Hollywood version of a heart attack, right? The sudden clutching of the chest, dramatically collapsing to the floor. But the reality for adults over 60 is totally different. As we age, the nerve pathways that carry pain signals actually become less sharp. Your body's communication changes, turning what should be a dramatic, catastrophic event into deceptive whispers and really ambiguous pain. So let's look at how a heart attack actually builds in the dark. It starts over decades, especially after age 60, with plaque buildup inside those coronary arteries. It's kind of like rust slowly closing off a water pipe. For a long, long time, you feel absolutely nothing. But then, step 2, that plaque ruptures. Step 3, the body detects the injury and sends in clotting agents, forming a blood clot. And finally, step 4, that clot grows large enough to cause a complete blockage. The blood flow is just cut off entirely. And here is the absolute crucial point. Time is muscle. When that blockage happens, that section of the heart muscle literally begins to die. We aren't talking in hours, we're talking in minutes. Every single minute of delay means a permanent loss of heart muscle. And lost heart muscle, it doesn't grow back. This is exactly why you cannot ignore the subtle signs, and why the window of time between the first symptom and getting treatment is the single most critical factor in survival. Moving right along to Section 2, 4 misleading warning signs, the deceptive symptoms. We are going to decode the 4 specific, highly confusing symptoms that consistently trick older adults into doing absolutely nothing. The very first misleading sign is severe indigestion or stomach discomfort. It's wild, but many heart attacks, especially in women, actually begin with a burning, nauseous feeling in the upper abdomen. And here's how your brain gets tricked. The vagus nerve runs all the way from the brain, down through the chest, and into the abdomen. It can actually transmit the heart's distress signal straight down to the stomach. Your brain misinterprets the signal, completely tricking you into thinking you just need some antacids, when in reality, your heart is literally starving for oxygen. The second deceptive symptom is unexplained jaw, neck, or tooth pain. Honestly, it's surprising how many people call a dentist instead of an ambulance for this. You might wake up with a dull ache in your jaw and just think, oh, I must have slept wrong. But this is due to referred pain. The heart and the jaw actually share overlapping nerve pathways. So when the heart is under severe stress, that pain signal travels up and registers in your teeth or neck. Always treat unexplained jaw pain, especially if you have any chest pressure with it, as cardiac until proven otherwise. Third, you need to watch out for unusual bone-deep exhaustion. And I'm not talking about ordinary everyday tiredness here. This is an overwhelming heaviness where just climbing a single flight of stairs leaves you completely breathless in a way it definitely didn't 6 months ago. And it doesn't resolve with a good night's sleep. Why? Because the struggling heart forces the rest of your organs to work so much harder. Your entire body is basically being forced to run on reduced fuel. And the fourth whisper is sudden anxiety or a really strong sense of impending doom. Now, I know this one sounds purely psychological, but it is deeply physiological. Survivors often describe an intense, sudden wave of dread just minutes or hours before the event. This is literally your body's emergency alarm system activating. The massive release of stress hormones in response to the cardiac distress creates a sensation that your mind just registers as overwhelming anxiety. All right, section 3. The immediate action plan, the danger zone. This is where we need to talk about the exact emergency protocol for when these whispers get loud. Because a heart attack is for sure not something you try to sleep off or monitor from the couch. These are the absolute danger zone symptoms. Chest pressure lasting more than a few minutes, pain spreading to the arms, back, or jaw, shortness of breath, cold sweats or nausea coming on suddenly, and sudden extreme weakness. Listen, these are absolutely not wait and see symptoms. They are call 911 right now symptoms. And crucially, for adults over 60, if you experience these, especially a combination of them, do not attempt to drive yourself to the hospital. The risk of losing consciousness behind the wheel is just way too high. So, here is your strict 5-step survival protocol. Step 1, call emergency services immediately. Step 2, chew 1 325 milligram regular aspirin, assuming you aren't allergic, of course. Notice, I said chew it, do not swallow it whole. Chewing gets it into your bloodstream significantly faster, which prevents platelets from clumping and stops that clot from growing. Step 3, sit or lie down to reduce your heart's oxygen demand. Step 4, unlock your front door so the medics can actually get in. And step 5, stay on the phone with emergency services until they arrive. Finally, Section 4, long-term heart protection, the architecture of survival. Because surviving a warning sign is just the beginning, we really need to talk about the long-term, daily habits to prevent this emergency from ever happening in the first place. The biological factors working against your cardiovascular health, they're active every single day. You can't feel high blood pressure, you can't feel elevated cholesterol. Because they're completely invisible, making sure you know and monitor your numbers is absolutely non-negotiable. Plus, taking your prescribed medications, like statins or blood thinners, exactly as directed every day is doing profound protective work inside your arteries that you can't even see. Oh, and definitely talk to your doctor to see if a daily aspirin therapy is appropriate for your specific risk factors. Next up, 30 minutes. Clinical research shows us that just 30 minutes of moderate walking daily significantly reduces your cardiovascular risk. You really don't need a fancy gym membership or expensive equipment. You just need consistent daily movement. A simple, brisk walk around the neighborhood after dinner is an ideal way to build this into your routine. You also need to keep a close eye on your daily sodium intake. Under 1,500 milligrams is the goal if you've been advised to reduce salt. And remember, the real danger here doesn't usually come from the salt shaker sitting on your dinner table. The vast majority of sodium is literally hiding in plain sight within processed foods, canned soups, breads, and deli meats. You really have to read those labels to protect your arteries. All right, to wrap up this explainer, let's lock in 3 core takeaways. Number 1, don't wait for the Hollywood version. The symptoms are subtle, like indigestion or deep fatigue. Number 2, time is muscle. Speed is absolutely critical, so call for help immediately and never drive yourself. And number 3, your daily habits, your medications, your movement, tracking your numbers, those are your ultimate defense and the true architecture of your survival. I want to leave you with this vital question. Who needs to hear these whispers? Ask yourself this right now. Please share this explainer with a loved one, a spouse, or a friend over 60. Because in an actual cardiac emergency, the person who recognizes these subtle signs might not be you. It might be them. Give them the knowledge to act. Your heart has been working for you without a single rest for your entire life. It absolutely deserves your attention. Thanks so much for learning with me today. Take care of your heart. It's the only one you've got.